Okay, hi everybody and welcome. I am Tia Trevisano with the NYANP and I am really excited to welcome you all tonight. We are very grateful to Dr. Alexis Chesney, who is joining us for her second presentation. For those of you that have gotten a chance to see or listen to the first one, it was absolutely excellent about Lyme disease, emphasizing prevention. And today we're going to go a little bit deeper into some of the topics around Lyme disease. So I would like to introduce Dr. Chesney and also our webinar sponsor tonight, NutriMedics. Dr. Alexis Chesney MS ND LAC is a naturopathic physician and acupuncturist specializing in Lyme tick-borne disease. Dr. Chesney received an MS in acupuncture and a doctorate in naturopathic medicine from the University of Bridgeport in Connecticut. She works full-time at Sojourns Community Health Clinic in Westminster, Vermont, and also has a private practice. She is a member of the AANP, Vermont Association of Naturopathic Physicians, and the International Lyme and Associated Diseases Society, ILADS. She's a founding full member of International Society for Environmentally Acquired Illness. And Dr. Chesney has served on the board of directors and is currently the Naturopathic Medicine Committee Chair for ILADS. She serves as a preceptor for the ILADEF Physician Training Program. She's the author of Preventing Lyme and Other Tick-Borne Diseases, released through Storey Publishing, and speaks on tick-borne diseases at conferences and in the media. So we are very grateful to have Dr. Chesney tonight. And as I mentioned, our sponsor is NutriMedics, who since 1993 have been faithfully producing high-quality nutraceutical products and believe that the best supplements are free of unnecessary additives. They go directly to the source to ensure that their ingredients are as pure and as raw as possible, with a full line that supports detox, microbial defense, and sleep mood. All of the other herbal supplements are designed to encourage optimal health, and they pride themselves in special product formulation processes that keep you and your unique needs a priority. They conduct extensive research to secure the highest quality raw materials from nature's richest botanical resources, and the unique enhancement process optimizes the whole herb for more powerful broad spectrum concentration. So again, we are very grateful to begin this webinar tonight, and welcome Dr. Chesney. Thank you so much for joining us again.
Thank you so much, Dr. Trevisano. It's so great. Thank you, Nicole, and to everyone at the NYANP. I'm going to share my screen. We can get started. Yeah, thank you for showing up today to learn more about the diagnosis and treatment of Lyme and tick-borne disease. Since there are over 350,000 cases a year of Lyme disease, and more cases of these other tick-borne diseases every year, especially in the Northeast, it's such an important topic. So I hope that I can share some pearls with you so that you can go back to your patients and provide more care for them. All right, let's get started. So today, just a little recap so you know where we're coming from, what I'm building on. If you haven't gotten a chance to attend or listen to the first webinar about preventing Lyme and tick-borne disease, we talked about North American tick identification, how to prevent tick bites, and then the diagnosis and treatment of acute blacklegged tick-borne disease. So building on that, we're going to review the signs and symptoms, which we did talk about last time, of blacklegged tick-borne diseases like Lyme disease, and review the 2 standards of care. Then we'll talk about laboratory testing for blacklegged tick-borne diseases, and then we'll move into treatment of blacklegged tick-borne diseases, talking about pharmaceutical antimicrobial treatment and comparing the 2 standards of care there, moving into natural antimicrobial treatment, and then of course talking about the naturopathic approach overall to treatment, which is of course my approach you'll be hearing about. So let's talk a little bit about complex chronic illness. I think it's really important to frame today's talk in this way, because working with patients who have Lyme disease past the acute phase, when we're into chronic illness, often there's a lot more going on. Sometimes it's straightforward, but a lot of times it's pretty complicated. So I think it's important to put on that hat of being a medical detective when working with these patients. And so taking a really good medical history, thinking about specialized lab, and of course holding space for the whole person is so important with complex chronic illness. It really takes critical thinking and decision making, partnering with your patient on all of it, and creating a really individualized treatment plan for them. So we're going to cover a lot of topics. Some I'll go through a little faster than others, but you'll have the PDF, which you can upload, and you can always refer to all the details. But yeah, so first, another just background here is tick-borne disease is the great imitator. You may have heard of that, right? We often talked about Lyme disease as the great imitator, but now add some other tick-borne diseases. Sometimes people have co-infections and are dealing with more than Lyme, or even not Lyme, but something else. And it gets more complicated. So just thinking about, asking patients with more complex chronic illness about, have they had a tick bite? Have they had a flea bite? Because what about Bartonella, which we're not going to cover too much today, but that's another important co-infection that can happen. High-risk activities around, prone to ticks in the outdoors, environmental exposures, get a clear understanding of symptoms, because a lot of what I do is track symptoms with patients, because in the end, Lyme and tick-borne disease is often a clinical diagnosis, and navigating through treatment, as you'll see, it's really important to have a good handle of the symptom picture. Other things to do to get started would be, look at the old labs, look at what's been done. A lot of times when people are dealing with more chronic illness, they've already seen many other doctors, and finding out what has worked, what has not worked, what's been ruled out, what might need to be further ruled out or ruled in. So creating a list of differential diagnoses is really important, which can change over time. As you find out, actually babesiosis is there too. There are antibodies like ANA is positive, or, as you go along, you can clarify the picture and make sure to identify the pieces of the puzzle. So I often talk about this with patients, that we're really looking at different pieces, and often people come to me for Lyme and tick-borne disease, so that's one of them, but a lot of times there are others, and it's really important to partner with patients on creating a team for healing, often beyond me, to really get to all these pieces and address what's going on and help the patient navigate through this healing journey. Okay, so we've come to the black-legged tick-borne diseases. Now, there are other ticks in North America, which I discussed at the last webinar, and I'd be happy to do another webinar in the future. The Lone Star tick is also in the Northeast, and there are other ticks throughout the United States if we wanted to open it up more. But I think the most important one for the NYANP, thinking of starting here and where I'm located, is the black-legged tick-borne diseases. So we're going to start with those. Of course, there's Lyme disease, which is caused by Borrelia burgdorferi, which you probably know, but also Borrelia mayeni, which is in the north central states. Anaplasmosis, babesiosis, tick-borne relapsing fever, which is Borrelia miyamotoi, a different Borrelia, but treated the same way, and Powassan virus. So let's dive in to all of the signs and symptoms. I'm not going to spend too much time on all of this because there's so much to cover. Of course, there's the rash that you can get from Lyme disease, and we'll see pictures later, so I'll talk about it then. What are other presenting symptoms in the acute phase of Lyme? Often there's a fever, flu-like symptoms. Later on, new joint pains, joint swelling, new muscle pains, new headaches. Also, there could be fatigue, malaise. It can affect the heart, so cardiac symptoms like chest pain, shortness of breath. Also can come up, and of course, neurological symptoms. Now, acutely, you could have Bell's palsy, but later on, usually it takes, maybe a few weeks to over a month to develop the neurological symptoms. Not always, though. You could develop things like tingling and numbness, shooting, burning sensations, odd crawling or prickling neuralgias. Also, even things like psychiatric changes, personality changes, confusion. So there are quite a lot of symptoms that can develop over time with Lyme disease. We know the great imitator. So here's our perfect bullseye rash. It does not always look like this, right? So this is less than 50% of people with Lyme will call a bullseye rash. It takes 3 to 30 days to develop. And the actual diagnosis of Lyme can be made by this rash. If you find this rash, you do not need to do testing. We'll talk about how that's not going to be accurate for 4 weeks anyway, and usually the rash comes before that. So if you find this rash, please start treatment. The rash technically needs to be more than 2 inches in diameter. So sometimes people will have local irritation. That's normal because they had a bite and there's a wound. Sometimes people find that it's itchy, so they scratch it. That can make it a little irritated, right? So this is a different rash. This is going to be more than 2 inches. And it, as it sounds in the name, erythema migrans, it migrates over the body. It can get up to 70 centimeters in diameter and distort over body parts. So here are some other more realistic sometimes pictures. These are culture positive Lyme rashes. So you can have diffuse borders. You can have, I just saw somebody last week that had a actually perfect bullseye, but right in the center were all these blisters, and it was purple. And then, you could have the disseminated rash. So many, these are often very bullseye-like all over the body. But it can be oval, it can be circular, it can be a little less so, like that first picture. But we're looking for the over 2 inches and around a tick bite, if one is known, of course. If it is the disseminated rash, often none of them are around that bite, which is kind of interesting. I do want to mention pediatrics. So the highest proportion of new cases of Lyme disease are in those who are 5 to 9 years old. And sometimes these folks present differently. So please look out for this with the pediatric population. Sometimes we'll see in kids GI issues, which I don't usually see in adults with Lyme. Things to look out when they're really small: developmental delays, difficulty with speech, motor coordination, just making to that next benchmark that's supposed to happen. This should be in the differential. Lyme disease should be in the differential when that doesn't happen. Of course, it could be something else, but it's something to really pay attention to. I've had some children in my practice that that's the way it showed up. Also tactile sensitivity, sensory integration problems. And also sometimes it's just, a behavioral change that's just unusual, or fatigue. A kid that, loves playing baseball, just can't get off the floor, is just laying down all the time, very unusual, something like that. Okay, let's review the signs and symptoms of anaplasmosis. So here, I want to highlight fever and severe headache. So whereas in Lyme disease, a fever, this is acutely, right? You'll have a fever, maybe up to 100, 102. Anaplasmosis acutely will be 104, 105. Usually these people go to the ER because it's a really severe acute illness. And usually they'll say it's the worst headache they've ever had. So those are the two most common symptoms. But of course, we have muscle pain, fatigue, these other symptoms that can come with anaplasmosis. Now thinking about Borrelia miyamotoi, which can be carried by a black-legged deer tick. This causes tick-borne relapsing fever. So reviewing that, as it sounds, relapsing fever, these are symptoms that can come and go. So you can have high fever, also some of the similar symptoms as these other tick-borne diseases, like headache, muscle and joint pain, nausea, vomiting, which is a little different from Lyme. And then some less common symptoms like loss of appetite, some GI issues, a rash that can happen sometimes. But it's that really relapsing, remitting fever that is the highlight of Borrelia miyamotoi. To review Powassan virus signs and symptoms, again, these folks are probably going to go to the ER. They're going to be very sick. So early symptoms could be just sore throat and feeling tired, headache, and then the fever comes and the scarier symptoms can come: difficulty breathing and speaking, seizures, even paralysis. And unfortunately, it's very common for these patients to continue to experience symptoms over time, even if they lessen, but they can have remaining neurological issues after experiencing Powassan virus. So luckily, this is a rare disease, as we talked about last webinar, but it can be fatal. Okay, so let's move into the two standards of care. We're going to talk about this a lot today. I think it's good to have this background. So we have the Infectious Diseases Society of America, and then we have the International Lyme and Associated Diseases Society. So these are two different standards of care out there, which makes it complicated for patients to navigate. So we'll see what that looks like now. So IDSA also, so they've created the background for the CDC guidelines in treating Lyme and tick-borne disease. Joseph Burrascano, an MD from New York, actually, he created guidelines many years ago, and the ILADS built upon those guidelines. So also comparing, there's we see less sensitive specific tests being done under the CDC guidelines, shorter antibiotic regimens recommended, and saying there's no plausible ongoing infection here, whereas ILADS might recommend better testing, more options for accuracy in testing, longer antibiotic regimens, and that, yes, in fact, there's proof, there's evidence, scientific evidence, many studies showing that there can be an ongoing infection. So here's some references. I like to provide both sides, and then we're going to move on to, of course, more information on what I've learned and my experience and through mentoring with doctors like Dr. Horowitz. But I think it's important that you see the resources there, the IDSA guidelines and the ILADS guidelines. And this is a comparison regarding research. Okay, so now we're going to move on to testing for tick-borne diseases. So this part, I'll go through some highlights. There are different types of testing that we'll talk about, and then we'll really narrow down to the recommendations for the black-legged tick-borne diseases in particular. So indirect versus direct testing. So of course, indirect testing is looking for human antibodies, for example, instead of the pathogen itself or genetic material from the pathogen. And so you'll see IgM, IgG, these types of tests. And so, yeah, so let's talk about ELISA a little bit. Basically this technology kind of builds on itself, and this is a lot of details. So we're looking at the body's response to coming into contact with a pathogen and making these antibodies. And then in the lab, doing different type of techniques in order to identify that. So the ELISA test comes up in the IDSA/CDC guidelines. And so that one is an important one to note to understand that technology. The Western blot we're going to talk about. So then they use this gel electrophoresis. And then next, the immunoblot, which is what I recommend and I use, which is even better technology using that gel electrophoresis. And then we have direct testing. So this is when you're looking for the pathogen itself or the genetic material of the pathogen. We have PCRs, which during the COVID era, we are very familiar with that type of technology. And then we have the fluorescence in situ hybridization, the FISH test, which is looking for either DNA or RNA of the pathogen in blood, which is important. We'll come back to that. So let's run through the different testing options for blacklegged tick-borne diseases. We have Lyme disease first up. So IDSA and CDC guidelines look at the standard two-tiered testing. You're probably familiar with this. This is the test that you would get if you went to a hospital. Step one is the ELISA test. So this is looking for the IgG, IgM antibodies, but they don't give you any details. They just tell you it's negative or positive. That's it. And actually, the CDC admits this was created for surveillance purposes only, not for diagnosis, which is really interesting. Step two, now if the step one ELISA was positive, then you go to step two, which is testing for a Western blot. So this is going to be a little more accurate. But they have a criteria, very specific criteria, and you need 2 bands or antibodies positive with the IgM, and you need 5 bands or antibodies positive for the IgG. Recently, there was an update, which was kind of interesting. They said, you could continue to do the standard 2-tiered testing, or you could do this modified 2-tiered testing. The modified, actually, we'll go through these pictures here. So here's the standard 2-tiered testing, right? It's just a nice little schematic showing what to do as we discussed. And then the newer idea is, well, do that ELISA, and if it's negative, do another ELISA. So, there's some criticism with this because the ELISA, unfortunately, is not that sensitive or specific. So there's some conversation around that. So let's talk more about this type of testing. The CDC, the commercial labs out there, like if you go to Quest or LabCorp or a hospital, they're using a very specific strain that's just the most common, right? So this is the Borrelia burgdorferi sensu stricto B31. And they're going to do this 2-tiered testing. That's still pretty standard, that they're going to do the STTT. They do claim that it is more accurate after the early phase, after 21 to 28 days. So I'm glad about that. That's definitely agreed upon by the ILADS community. And so waiting to test, sometimes people go to the ER just, several days, within a week or so of a tick bite with, say, an erythema migrans or some symptoms, and they'll get tested, but we know it's too soon. So everyone kind of agrees on that, actually. So that's important to note. Now, under CDC guidelines for Lyme arthritis, you can test PCR of synovial fluid. And for certain patients, if you have neurological symptoms, they might recommend testing the cerebral spinal fluid in addition to blood. Another option is the C6 peptide. That's a blood test you could also think about using. And I think it's important that CDC and ILADS both say that it's important to remember that the erythema migrans rash is diagnostic of Lyme disease. So CDC says antibodies can take several weeks to develop. Agreed. Antibodies normally persist in the blood for months or even years after the infection is gone. Therefore, the test cannot be used to determine cure, which is really interesting because that comes up a lot. Can we retest somebody and see after treatment, are they better? Has it resolved? Is Lyme gone? And actually, retesting does not tell us anything. So actually, both sides agree on this too. Some tests give results for two types of antibodies, IgM and IgG. So the CDC says positive IgM results should be disregarded if the patient has been ill for more than 30 days. I might disagree. Studies do show that IgM can persist. So testing both IgG and IgM whenever it is that you meet this patient in their journey of symptoms, it is important to test both. Okay, moving on to ILADS guidelines. So the two-tiered testing method results in far too many false negatives, and there are a lot of studies showing this. Like the New York State Department of Health found CDC's two-tiered testing missed 82%. That's huge of positive Lyme cases, right? It was shown that the kits were only 36 to 70% sensitive. That's a huge range, right? And, just not very accurate. And then there's a Johns Hopkins study that found it missed 75% of positive cases. Again, not a very accurate approach. The ILADS guidelines state that a positive Western blot need only show one species-specific band to determine an exposure to Borrelia burgdorferi. And this is the list. People like to see this list of the species-specific bands when you do a Western blot, for instance, or an immunoblot, as we'll talk about. Also, the IgM antibody response to Borrelia burgdorferi can persist for years. And ultimately, Lyme disease is a clinical diagnosis. So certainly looking at lab testing after the 4 weeks from the tick bite is important, but also thinking about the patient's history, the medical history, and the presentation of the signs and symptoms is really important. So ultimately, it is a clinical diagnosis according to these guidelines. Okay, so let's talk more about the Western blot. So going straight to the Western blot, right? So you could do the ELISA and see if it does a reflex, and then maybe it'll then have the lab test for the Western blot with that two-tiered testing strategy. However, you could choose to just do the Western blot right off the bat. So Western blot by certain companies includes other bands. So this is really important. Bands 31 and 34, which are associated with these proteins that are the outer surface proteins A and C on Borrelia, they're included in this test. So there's some history here. In the past, they were included in the commercial regular labs. However, these are the proteins that were actually used in the Lyme vaccine back around 2000, which lasted about a year or two and were pulled from the market. So they're no longer available. This vaccine is no longer available for 20 years, right? And so it's frustrating that thinking about a patient not being able to get this testing for bands 34 and 31 at a regular commercial lab. So choosing a lab, a specialty lab that includes these bands is really important and increases the accuracy of your test. Clearly, if it was used for a vaccine, it was agreed upon that these are pretty important antibodies, right? So, so that's an important piece to note. And then also using the 297 strain of Borrelia burgdorferi, in addition to that B31 strain that's used in the commercial tests, will also increase sensitivity. And then thinking about any positive Lyme-specific band, right, opposed to that criteria that we looked at, 3 bands of IgM and 5 bands of IgG. Instead, just looking at which are actually the Lyme-specific bands or antibodies, right? And really just looking at those in order to make the diagnosis if we're just looking at labs. Also, in addition, we're looking at symptoms. So the Western blot is a little bit better, about sensitive and 93 to 97% specific. So that's much better than the ELISA test. But we do have the immunoblot. So this is 90% sensitive and 98% specific. So this is using the Borrelia burgdorferi, sensu stricto, both the B31 and the 297 strains, and also Borrelia burgdorferi sensu latu. And so these are a list of others, like Borrelia mayeni is a species of Borrelia out in the north central states in the US. And it causes Lyme disease. So including this in this testing is important. The other strains are newer, or sorry, the other species are newer species being detected. The first 2, though, are species that are found in Europe. So this is a much better, so if I'm recommending this testing, I'm going to put a little star next to it. Ultimately, this is the most sensitive and specific test we have for Lyme disease. Okay, moving on to other concepts in testing for Lyme. The PCR, which we had mentioned, you know, we could do, certainly, but to remember that it only detects in early Lyme 18 to 20%. So the sensitivity is pretty low. It's very specific, right? This is a direct test, so it's looking for the genetic material of the pathogen, but the sensitivity is not great. But, you know, sometimes people, if they have like a swollen knee, you'll think maybe we'll look at the synovial fluid and it would be a PCR test. Sometimes people have a spinal tap if they are having some neurological symptoms, but of course, weighing the risks and benefits of doing such a test is important, along with the accuracy of the test that you're doing, I think is an important conversation to have with a patient. Let's move on to anaplasmosis testing. So anaplasmosis, I'll say this all the time, and people laugh, but you know, as unpleasant as it is acutely, you can be severely ill. It's easy to test for, and it's easy to treat, and we don't see chronic anaplasmosis. So, you know, you get really sick usually, and often people will go to the ER or, you know, seek out help because they feel so poorly with a high fever and that severe headache. And the testing can be done in the first week of illness. You don't have to wait 4 weeks. So that's really helpful. And that's the PCR test that you would do in the first week. After that time, you can do the IFA, the IgG, IgM, and it's accurate as well. So it's really helpful. And we'll come later to the treatment, which is very effective. The babesiosis testing, another blacklegged tick-borne disease that's really important to talk about. I think one comment I'd like to share is I'm so glad there's more and more education about Lyme disease out there. I think we need a lot more about babesiosis. Personally, I remember training with Dr. Horowitz, and 12 years ago, and he kept saying you have to think about babesia, and I was just getting a handle on Lyme disease, so I made note of it and thought, okay, I'll revisit that. Let's really get a better understanding of Lyme for now. But he's right. There is so much babesiosis out there, and often referrals that I get from other practitioners, people are on, they've diagnosed them with Lyme. They're on great treatment plans. The patient may be getting a little better, or certain symptoms have gone away, but there are these other symptoms that are there. And so many of the times it is babesiosis. That is also a co-infection. And once we get after the babesiosis, the Lyme can heal even better and the patient feels better. Because babesiosis symptoms can be scary. So I didn't say this today, but it's good to note. The babesiosis would be chest pain, shortness of breath without exertion, palpitations, and night sweats. So I'll have somebody present saying, oh, it's, I can't sleep because, and so why? Okay, insomnia is checked off. Let's talk about that. Many reasons for insomnia, right? And then I get a picture. I hear about how they'll lay down, they're tired, they're ready to sleep, they think, but their heart starts beating. They're not thinking about anything. They don't feel anxious. They're not worried, right? Because then practitioners will say, oh, you have anxiety, let's treat that. So they lay down, they have these palpitations out of nowhere. They wake up in the middle of the night with them, with night sweats. And then this odd air hunger or shortness of breath. So sometimes they just feel like they can't quite get their breath. It's kind of a unique symptom. So if you see folks with those symptoms, and it can come with the chest pain too, it can be very scary. And of course, there can be other reasons for these types of symptoms, right? So working through the differential diagnoses is really important. But, after the person's gotten the EKG and, is not in menopause, it's a guy in his 30s and he's having night sweats, it's important to work through all the differentials, but it's very classic for babesiosis. So please remember babesiosis. We have these different options of testing. I recommend the Babesia fish. It's most sensitive. And it is looking, that technology, right, is a direct test. So it's actually telling you there was current active Babesia because it's looking for the RNA of Babesia. So if you get a positive test back, that is going to tell us that there's current active Babesia we need to treat now. Compared to Lyme, so any of those Lyme tests that we talked about are all looking, most of them that we talked about are looking for antibodies. And so if it's that indirect test that's being done, that doesn't tell us if somebody has current active Lyme disease. It just tells us that at some point they've come into contact with Borrelia and made these antibodies. And we don't know for sure if it's still there, if the infection is still there or not. So I think it's really important to know that information, hence the clinical diagnosis of Lyme disease. With babesiosis, it's really helpful. This is not a perfect test, but so of course the clinical diagnosis, I would still, if somebody presents with that classic symptom picture, please do a trial of treatment for babesia. But this Babesia fish test is very helpful. Okay, so moving on to tick-borne relapsing fever. This is our Borrelia miyamotoi, who is a black-legged tick-borne disease pathogen. But there are other tick-borne relapsing fever bugs. So we're not talking about this whole list of them because the others, the Hermsea, etc., those are from soft ticks. And these are ticks usually in the south or the west, in places like cabins or caves. And so I'd love to talk more about it, but for the sake of time, we're going to move on. And just to highlight the purpose of this slide is to look at really the Borrelia May motoi testing. So you can do that IFA, you can do the PCR, but I do recommend the immunoblot, which is more accurate. And Powassan testing. So I had a patient that I diagnosed with Powassan. She went to the ER. I met her after that point. And while she was at the ER, severely ill, they sent a test off to the State Department of Public Health. And then I saw her several days later, maybe a week later in the office. We drew blood and I sent it out through a specialty lab, the Powassan. And it actually got back. We received those results quicker than what was done days before at the hospital. And it was positive. And then she did get a positive back from the State Department as well. It was really interesting. So it's really nice. I'm glad that I had that kit. I'm glad I could do the Powassan testing just to help clarify. She also had Lyme. You know, it was a complex, severe case, which is much better now. But it was great to be able to do that testing as well. So, and as we discussed, ultimately, these tick-borne diseases are a clinical diagnosis, especially Lyme disease. So, you know, what other tools do we have? Well, there's the Horowitz Lyme MSIDS questionnaire. So it is a validated screening tool that can help you determine whether your patient might have Lyme and tick-borne disease. I'm proud to say that the clinic I work in and patients that I had treated took part in the sample study that was done and published. So, you know, it's a really helpful tool for sure. The components of the questionnaire, it goes through a symptom checklist, a Lyme incidence scale, a healthy days scale, and the common Lyme score. So he created this way of just kind of calculating, you know, looking at certain symptoms, because certain symptoms are just so common in Lyme especially. And it's interesting to first learn about that questionnaire and to see how helpful it really was. So that's a really great resource you can definitely check out and use with your patients. It's great to give it to them, you know, or to have them fill it out before they come in. It can be really helpful. One thing to note is, you know, when we create these differential diagnoses to work through, you know, migratory pain, you know, there are a handful of diseases that can cause that, but that migratory pain, joint muscle pain is just very classic for Lyme. And the only disease with migratory nerve pain is actually Lyme disease. So if somebody comes in with these nerve pains that unfortunately I hear a lot that other practitioners may tell them it's all in their head, but things like or bee stings or electric shocks, bugs crawling in their skin, these types of neuralgias. It's very common with Lyme disease, and it'll move around. So it'll be in somebody's leg, and then it'll be in their arm, and come and go. So that's very classic for Lyme. So yeah, so you can check out that questionnaire, see if that helps. So ultimately, we do have many testing resources for all of these black-legged tick-borne diseases, but thinking about the symptom picture is so important, and really putting together the puzzle pieces through that history taking and creating the differential list, as well as doing the lab tests, is going to give you that complete picture. All right, it's time to move on to treatment. So first we'll talk about pharmaceutical antimicrobials, and then we'll go into natural treatments and naturopathic care. So Lyme disease. So generally, again, we're going to look at care IDSA CDC guidelines, and then we'll look at the ILADS guidelines, and we'll kind of look at my approach. So with the CDC guidelines, generally they're saying 10 to 28 days of pharmaceutical antibiotics, and then you're all set, right? So, you can review here and the different antibiotics that you can use. And these are other guidelines you can look back on. When there's facial palsy, when there's meningitis, then they're going to be longer duration of treatment. Lyme carditis will be a longer treatment. And then Lyme arthritis. And so there's this term, post-treatment Lyme disease syndrome, PTLDS. So that's used by the CDC. And they say that patients can sometimes have symptoms of fatigue or difficulty thinking that lasts for more than 6 months after they finish treatment. So it's acknowledged that people do, unfortunately, continue to have symptoms after treatment. However, the CDC has the statement that continued antibiotics are not recommended. You can discuss symptom management with your healthcare provider instead. And they do, there's a little bit of an update now, which is interesting on their website, talking about, what's the cause of this post-treatment syndrome. And there's some theories like, is it an autoimmune process? Is it persistent Borrelia infection? Otherwise, unknown cause. So now we'll move on to the ILADS guidelines. So evidence does indicate that 20 days of prophylactic antibiotic treatment may be highly effective for preventing Lyme after a blacklegged tick bite. And the guidelines would claim that using the antibiotics early on is really important. The success rates for treatment of the erythema migrans rash, ranging from only 52 to 84% for regimens that use 20 days or fewer. So hence, longer antibiotic regimens are recommended. They're saying that patients are best served for 6 weeks. And ultimately, that chronic, they might call it chronic Borrelia burgdorferi, might require individualized treatment plans, where one person might need a shorter course and another may need a longer course. So the duration of treatment should be guided by the clinical response of the patient, not just a number of weeks. And it's not recommended to stop antibiotics too soon. Hope that there's, sort of this recovery if somebody's still having symptoms and they've met the, 14 days or 28 days still having symptoms, then it's really important to continue the treatment until those clinical symptoms. And lastly, ILADS recommends that patient goals and values regarding treatment options identified and considered, and that they're partnered with in the decision-making process of their treatment. So here are some guidelines for erythema migrans. So ILADS does set out these for the erythema migrans because this is acute Lyme disease. So doxycycline, 28 to 42 days, penicillin, or cefuroxime. And a patient with disseminated disease may need antibiotics or combinations of antibiotics. So ultimately, again, it is up to you to determine how long of a treatment they may need per ILADS guidelines. Now let's talk about chronic Lyme, right? So instead of the post-treatment Lyme syndrome, ILADS tends to talk about it in this way. It is known that 10 to 20% of patients who have been treated following conventional guidelines for Lyme continue to have symptoms. And both CDC and ILADS agrees on this. Studies show this. That's a lot of people when you have 350 cases a year. We also have this chronic Lyme disease definition by Samuel Shore as part of ILADS. And so they came out with a study documenting how they came to this definition, that they define chronic Lyme as a multi-system illness with a wide range of symptoms and signs that are either continuing or intermittent for a minimum of 6 months. It's a result of an active ongoing infection by any of the pathogenic members of Borrelia burgdorferi sensu lato. And so let's talk about this evidence that there is a persistent infection in chronic Lyme disease. So there are many studies. The round form is resistant to antibiotics. Also, there are biofilms that can be responsible for chronic infections, and they contribute to this persistent Lyme. So let's review what we have. Lyme, the Borrelia burgdorferi pathogen, is a spirochete bacteria. And it can create a round form, also called a cyst form. And so it is the round form or cyst that is resistant to antibiotics. So that's where our herbs come in. Grapefruit seed extract and cat's claw, otoba, Japanese knotweed. We're going to get into all that. That's where naturopathic medicine shines here. The spirochete, yes, you can address the spirochete with pharmaceuticals, but you need more than that. And then we have, so this biofilm is a fibrin layer that is created around the spirochete. So you get a community of spirochetes, a bunch of them get together, and then this fibrin layer called biofilm, and they hide out in this way. So these bacteria are survivors, and we need a way to film, which again is where natural therapies shine. So here are some references. There are many, if you want to read about it. And lastly, another cause for persistent Lyme is co-infecting organisms. So like I was saying, babesiosis in addition to Lyme, but it's not being treated, then the patient is not going to heal. So symptoms can be exacerbated by this. And it's really important to identify and treat those co-infections. So here are more references. And at the bottom, if you want, this really long list, you can definitely look at the peer-reviewed evidence of persistence of Lyme disease down at the bottom link. Okay, so let's come back to acute Lyme and build this. So again, starting out, you've identified somebody who has Lyme disease. Maybe it's an erythema migrans, maybe an acute fever, flu-like symptoms, or maybe it's somebody who has been chronically ill that you've put it together, maybe done and the Lyme immunoblot is positive and you want to start treatment. So we can start here as well for those folks. So we'll do something cyclin or cefuroxime. I often use nystatin as well as an antifungal. then we can use Lyme Formula 1, which is cat's claw, knotweed, andrographis, and Chinese cat's claw. And that would be a teaspoon 3 times a day on an empty stomach. And that formula, of course, we'll talk more about this later, but does so many wonderful things as herbs do. But here we're also thinking about making sure to cover the round form. So whereas doxycycline will get to the spirochete, herbs in the Lyme Formula 1 will get to the round form or cyst form of Lyme. And lastly, serrapeptase is through biofilm. So that is very important. Serrapeptase must be taken on an empty stomach or else it will not work. And then 2 months past resolution of symptoms. It's really important to navigate this process with your patient looking at target symptoms. So I find it's really important to get the patient involved. You know, some people are more aware of their symptoms or their bodies than others. So of course there are different challenges that can come up, but really understand as you go through treatment what patients notice is really important. We'll talk about Herxheimer reactions. And so treatment, when you first start treatment, somebody can have what's called a Herxheimer reaction within 2 weeks, usually, treatment. This is a die-off reaction. So when you start treatment and you're killing Lyme, then the Borrelia release toxins and the person feels worse. So if they had migratory intermittent joint and muscle pain and brain fog and fatigue and neuralgias, then those are the symptoms that would get worse if those symptoms are the symptoms. So it can be really clarifying to use that Herx reaction as a tool with the patient. And the other way it can go is that they can just feel better, like much better, right? So we're looking for a remarkable change when we initiate treatment with a patient. And this is more so for a chronically ill patient. So if somebody had Lyme for maybe years, who knows? History, kind of go back, oh, you've never felt well since that tick bite. Okay. And here's your list of symptoms. Well, let's see what happens if. And so you can start treatment and do a 3 to 4 week trial of treatment. There are other ways to do this. We're not into all that today, but just to give you the concept so you know what to look for. You have your list of symptoms. You ask the patient over time, they come back, they say, wow, 3 days in, I just felt terrible. You know, the joints got worse. I had to stay home from work, whatever it might be. And there's a lot to do to support a patient through that, of course. Really helpful. The other way it can go, maybe 10% of the time, if somebody has Lyme and you're doing a trial of treatment, is that they could have a remarkable improvement and say, yeah, I feel great. I don't have any more joint pain. You know, I still have some fatigue and brain fog, but it's better than it was. It's pretty amazing. So sometimes, and so that's also very important. I think it's important to note that when you do a trial of treatment or when you first begin their way, and if somebody just continues to feel the way they do, they just say, yeah, I don't know, over the last month, you know, this is the same, that's the same, nothing really happened, then actually in certain circumstances when we do this, it could not Lyme disease. So there's a way to also use a trial of treatment in a more diagnostic way if unable to do testing, maybe because of finances or because they had Lyme in the past, and that's not going to tell us if they have Lyme now. These are ways you can use trials of treatment. And then so you go through treatment. I recommend switching up treatment over time and talk about that a little bit. And then treating 2 months past the resolution of symptoms is really important. So again, tracking symptoms, trying the best we can. Might be fatigue for other reasons, but that's the Lyme fatigue. All right, that's better. You know, maybe somebody has a shoulder injury and you need to determine, that's CPT, work through that. Oh, no, that other pain, that's definitely Lyme. We've got to resolve that. So it takes time to do this with patients. And then treating the 2 months past the resolution, it's really important to get to because of that reproductive cycle of Lyme bacteria. Okay, we're going to look at different antibiotics. So I mentioned doxycycline and cefuroxime. Those are the two most common I would start with. But, you know, I think just slides noting that there's going to be side effects and cautions. I've also put in here the mechanism of action and the pathogens that are targeted, which is nice. Like doxycycline gets both anaplasma and Lyme. So you are, you know, starting with somebody who has an acute presentation of Lyme disease after a known tick. Do the doxycycline because cefuroxime does not cover anaplasmosis. So it's these kinds of you know, critical start to do as you see people and think about, you know, what do we want to cover. I work in Vermont. Vermont, unfortunately, is #1 in years with anaplasma cases. So, and I had so many this summer. So, you know, I'm always trying to think and to make sure to cover probably both Lyme and anaplasma when somebody comes in with a very, you know, acute presentation like a fever, etc. But yeah, so we've got the tetracyclines, and now we have macrolides. You can use azithromycin, and rotate through different antibiotics. Penicillins, honestly, I don't see a bicillin, which is an IM, is more effective than amoxicillin orally. Cephalosporins like the cefuroxime, ceftriaxone is also either IM or intravenous. And then we have metronidazole. These also get to the round form of Borrelia and to Babesia, so that's important to note. For drugs that get to Lyme and Bartonella. And then newer strategies, so dapsone and disulfiram. I've been using these as well. I trained with Dr. Horowitz with the double dapsone protocol, and disulfiram has been very effective. Of course, there are a lot of contraindications, interactions, monitoring, side effects. So not everybody is a candidate, in my opinion, or in my practice and the people that I see for dapsone. So I'm very discriminating as to whom I would put on these kinds of protocols that are very complicated. Someone may actually not be able to do it for a number of reasons anyhow. So, but it's nice over the years to see more and more research coming out about newer strategies, both in the world of pharmaceuticals and in the world of natural therapies, which we'll see later. Pharmaceuticals, of course, as a naturopath, thank goodness, we're going to be thinking about the gut biome. So as you know, we're going to use probiotics, and you could use nystatin. If you're using cefuroxime or clindamycin or amoxicillin, adding Saccharomyces boulardii would be a good idea to prevent C. difficile. Talk about anaplasmosis treatment. This is a short and sweet one. So as I mentioned before, doxycycline. The thing is, in the summer, it is tough because of sun sensitivity. So depending on where the patient lives or work is like, I live in a place that's very rural. And so we have a lot of people who, like, of them are farmers and loggers and, outside a lot. So I will have to be very repetitive in my warning and give many examples of what can happen with doxy to these folks. But for anaplasmosis, it's the only alternative that is in the literature is rifampin. But other than that, we've got doxycycline. So, and it's 2 weeks, right? So sometimes, for 2 weeks, hopefully, people can find a way to do it. You do need to cover up when you go outside, especially if we're doing a higher dose. With Lyme, I do 200 milligrams twice a day. So if I'm thinking of Lyme and anaplasma, I'll do 200 twice a day. So if I'm thinking of both, I might do 200 twice a day for 14 days. Pyroxene to continue treating the Lyme, which is going to need more time to treat, versus anaplasmosis, 2 weeks is fine. So things to note is really covering up. I have a lot of people who will do that, but then they'll be driving in the car and they get 4 people this summer, despite telling them about it. And there's only so much one can do, and it is a difficult thing to do. But they've had the same rash all on the tops of the hands from driving. So they can get all blistered. It's pretty awful. So wearing gloves when you're driving, which no one wants to do in the summer, right? But that's really important, actually. And thinking about the ears, the nose, the neck, the face, the hands and feet when you're outside, especially if you're outside at all. Sunscreen doesn't tend to work, but something like zinc oxide, when it's really white on the face, can work, or a big brimmed hat. So just a few notes on doxy. All right, so our acute anaplasmosis treatment, we could add the formula. I don't always do this. Doxycycline could be it. I would add the serrapeptase for biofilm. We don't actually know if anaplasma creates biofilm or not, but I want to use it in there anyway. And if somebody wanted to do more with herbal strategies, then we'll use things like houtunia, red sage, and astragalus, and just treat for 14 days. Get those probiotics in there, of course. For babesiosis treatment, Babesia is a parasite, right? So there's not going to be any overlap here. So if somebody has Lyme and babesiosis, we can't just choose one treatment protocol. You could do the atovaquone azithromycin and know that azithromycin treats Lyme. So sometimes I'll think about it that way. Atovaquone is an antimalarial, and azithromycin together with the atovaquone is synergistic and more effective at killing Babesia. You could also do the clindamycin quinine. I don't really do this much anymore because of side effects. I see that atovaquone azithromycin works well. And this is the CDC anyway, but yeah, I would just do longer protocols. So this is the CDC guidelines for babesiosis, and looking at my treatment plan as a template here is one way you could do it. Getting red sage in there is really helpful. So as a parasite, Babesia infects red blood cells. So thinking about things like arginine to keep it out of the red blood cells, and red sage to protect the red blood cells and the endothelium, as well as immune support. I mean, red sage is wonderful, is a great way to go. And Cryptolepis, Sida acuta bidens, I created these formulas like Babesia formula, I call that one. You can also use that, or you could rotate through, as we'll talk about later. Strategies around treatment is rotating from one treatment plan to another over time. And of course, treat 2 months past the resolution of symptoms. Now we have our tick-borne relapsing fever, Borrelia miyamotoi. The CDC guidelines, it's a Borrelia. So it's treated the same as Lyme, doxy, amoxicillin, or cefuroxime. And so in the literature, there's more about tetracycline. So I would probably go to that first, but you could also use doxy. That's also in the literature. It works. And you could use the Lyme formula, or we could call it Borreliosis Formula 1 for this treatment. Borreliosis Formula 2 is a supportive formula. So I call it the neurological immune support that sometimes we need when we're dealing with Lyme or Borrelia miyamotoi. And then serrapeptase for the biofilm. And finally, Powassan virus for treatment. So unfortunately, there's not a conventional treatment strategy for Powassan. People often go to the ER because they're having bizarre neurological symptoms and have a fever. But it's just palliative care, which has a place. Certainly it's important, yes. But there are no antiviral strategies that are given or anything like that. So naturopathic medicine has a lot, in addition to getting the cure people need in that acute setting in a hospital. So this is what I did with my patient who had Powassan. It's a lot. All of this is from my reading of Stephen Buhner, Healing Lyme. As you may know, he's an amazing herbalist. Highly recommend his books. He also has an antiviral treatment book. There's a lot in there that's really worth looking at too. So that's the Powassan treatment plan. And here we come to the naturopathic treatment of Lyme and Tick-Borne disease. So let's talk about the different pieces that we're going to cover here. We're going to go through natural antimicrobials, which we've gotten a little bit of a taste of in my acute strategies that I shared. Detoxification, which is often really important in chronic illness. The neuroendoimmuno support, which is usually really important with Lyme and other tick-borne disease. Supporting the mitochondria and supporting the connective tissue, nutrition, and supporting the whole person. Putting these puzzle pieces together. So first we have natural antimicrobials. I'll probably move through these quickly. Hopefully some of you are familiar, if not all of you are familiar with cat's claw, the top herbs used for treating Lyme. And so it has other strategies as well. We have Lyme, like the anti-inflammatory pieces that it provides, in addition to the antimicrobial action. So these slides are going to go through the mechanism, the side effects, the contraindications. So please go back and read through, and then there are references if you're interested. Here we have Japanese knotweed, which has been in a lot of, or a few, I should say, it's exciting. So, a few studies recently at Johns Hopkins in the treatment of Borrelia. So, we've seen in how polygonum works really well, and it's nice to have some studies to back that now. It kills Lyme, protective, which is usually really important, especially with chronic Lyme. It has specific effects on cytokines, brings blood and oxygen to the brain, and you can use it in Herxheimer reactions, and it all blood and protects a lot of the organs that can be affected by Lyme. And this is another wonderful anti-Lyme herb that has other properties. It crosses the blood-brain barrier. That's really helpful in a lot of these complex cases. Cryptolepis. Here's another herb that's been in lately at Johns Hopkins, showing properties of killing Borrelia and of Babesia. So there's a little crossover there. In the past, I was thinking about it as an anti-malarial herb, and we've used it a lot for Babesia, but now we know actually it is effective against Borrelia. Houtunia, viral, also used in Anaplasma and Ehrlichia, working on spotted fever. Artemisia, herb that's been in that same research. Sweet Annie, it's Artemisia annua, that's really important. So this is the one to use for Babesia, and now we know also for Borrelia. Sarsaparilla, now, you know, Stephen Buhner talked a lot about this in his first edition of Healing Lyme, and then in the second edition, he wasn't as big of a fan. So it was interesting. He talked more about Chinese cat's claw, which is a really interesting herb, but we could always use this. The thing is, there's so, which is really great. And I always tell my patients this because sometimes they get panicked. And I do use pharmaceuticals, but I also use natural therapies. And I think, you know, across the board, we just have all of these antimicrobial strategies that we can use, and rotating through different strategies is most effective. So, you know, sometimes one person will respond to one protocol, you know, have a bigger patient than another. And you know, I have my favorites, I see certain trends, but it's just great to rotate through and to try and match the picture with what's going on, the herbs that you use with the picture of what's going on. So here's one of those studies. Cryptolepis, knotweed, artemisia, cat's claw, all in here, and these others, which I'm starting to use more with thinking about Borrelia, you know, showing efficacy, doing better than cefuroxime and doxycycline. And then we've got some of the similar herbs, crypto, knotweed. I also love Scutellum, Chinese skullcap. I was using it a lot for neurological support. I actually, I've had some patients with seizures. They've actually taken it and it's prevented seizures. Now, of course, you know, that's a serious situation, and I'm not telling people that they're on, but you can take it in addition to whatever the regimen might be, and I definitely saw some great impact in patients on that. Anyway, but it also kills Babesia apparently, so that's exciting. Now let's look at some other research about cat's claw and Otoba. So basically there was this one study looking at both of those and showed the Uncaria tomentosa and Otoba were more effective at reducing round body forms and biofilm than doxycycline. So it's really interesting that these studies are coming out to show how natural therapies work, but then also putting them against the pharmaceuticals used for Lyme and showing, hey, actually, some of these natural strategies like the cat's claw and Otoba are more effective. And I think it's really important that, you know, for instance, this study looked at the round body forms and the biofilm, right? You know, my thought, probably why, because we know that the pharmaceuticals don't get to the round body forms and the biofilm. So it's probably why this is just in general coming up, that these herbs do more than one thing, right? They're not these synthetic engineered pharmaceuticals, just, you know, one mechanism. You know, our medicine just has such versatility and so many different properties that can offer to somebody who is suffering with Lyme and Tick-Borne disease. So here's just some graphs on particular. So it was the 1 to 40 dilution that was actually the for each. And then another study looking at both cat's claw and Otoba showed no colonies were left, which was really exciting. And that's some interesting fluorescence. So if you look through, it's pretty clear when you look through the control and then you've got just Uncaria by itself. It has some live cells there, and then Otoba has some dead cells in the biofilm there, and then Uncaria and Otoba, it's there's not much there, so that's good. Another study on stevia. So it's so I always think it's so funny, stevia of all things, that we might use blood sugar control and other reasons, and even just to sweeten something to make it taste sweet. I have patients that use it that great when I'm telling them not to eat sugar, but to actually have a study showing that it eliminates spirochetes and also reduces biofilm of Borrelia burgdorferi was really interesting. So that's another herb to use. So next, I just wanted to share some other natural antimicrobial strategies. So much time that we have to review everything, so you can go back and look at these different formulas. There's also, I included formula, knotweed, Elcornia, and Houtunia that I use to treat Bartonellosis, which is known to be flea-borne and has not been proven to be transmitted by ticks to humans yet. However, it has been found in ticks. So it may be something we need to include more in this type of presentation, but I can do a presentation just on Bartonella. I do see it a lot, as it's really important to note. It can create similar symptoms. I'd say some highlights of Bartonella, since it would be thinking about severe pain. Now, of course, Lyme creates migratory intermittent pain. I think the severity of pain experienced by people with Bartonella is higher. People who have a lot of cats, dogs, veterinarians. I've had patients that are vets who had thinking about people who have a lot of animals, or dog groomer, people like this. These are some good questions for medical history. And other Bartonella symptoms that would be classic would be pain at the bottom of the feet, pain, and neurological symptoms. Very, anger. Anger can be a big one. Of course, there's overlap with all of these vector-borne diseases, but just a snapshot on Bartonella. And so here is another of other formulas I've created that I use with my patients with co-infections. So we haven't talked about these co-infections today, but you've thumbs up, you have something to think about. And now thinking about biofilm is really important. So looking at agents, breaking through that biofilm in different ways. Again, there are many, many here to see. And here's some dosing for you. So number 2, detox. So naturopathic medicine really shines with detoxification, which is great. So we can share our pearls with our patients on this topic. So we've reviewed the Jarisch-Herxheimer reaction already, so this is important when you're doing treatment with patients, to educate them about this process so they're not surprised or they think something's wrong. It's good to prepare patients. Give them a handout that gives them things to do, so we'll go through those strategies of detoxifying the liver, gallbladder, which can help them through that Herxheimer reaction. So of course, the liver is an important focus. Here are some herbs I love pimpinella and desmodium. I see that they work really well in addition to some of the other more herbs like milk thistle and dandelion. Pimpinella is really, really helpful with neurological symptoms. So if I have a patient, going of treatment that I know has brain fog or, these odd neuralgias that we talked about, something like that, that I might, somebody who I would recommend the pimpinella. And nutrients, binders, many, many different we can use. So you can review these. Glutathione I definitely want to talk about. It can be really powerful. Not for everybody, it's not magic for everyone, but it can really make a huge difference. So I think it's important to think about both in the way of detox and its effect on the immune system. You can use IV glutathiones if you're doing IVs. It can be really that. Sometimes I have people come in weekly or every few weeks, depending on their symptoms and if they know that it helps, right? We might do one or to try it out and see what their reaction is. And if it's really helpful, they'll come back for more. If they really didn't notice much, maybe the IV is not as important just because of the time and effort and cost, but definitely somal oral glutathione I would continue with. And then of course non-oral therapies. So thinking about alkalinizing the body, the anti-inflammatory diet, getting enough water in to help the kidneys, things like sweating, thinking about skin as our detox organ. So many options that we have. And then we have neuroendoimmunological support. So Lyme and tick-borne disease can create a cascade of immune responses. So it increases monocytes, which then creates cytokines, which then creates basically inflammation, right? So we can follow that through biology, but focusing on inflammation, like what are we going to do? Magnesium is by Borrelia. So this one is an important one for the immune system, neurological system, magnesium in so many of our enzyme systems, as you know. Chinese skullcap, as I mentioned earlier, it is so neurological symptoms. And apparently now we found out it kills Lyme too. Stephania, I'll use this herb for eye issues. So I don't see it a lot, but sometimes my patients that have Lyme or Bartonella will have visual like a conjunctivitis or just blurry vision, double vision. That can be a tough one. And so adding Stephania, red sage, again, it's quite a winner. Kudzu, really nice detox herb too, as well, supporting the immune system. Eleuthero, so this is an adaptogen, so thinking about the endocrine is important too. And here are a host of other options that, a lot of my patients will be perhaps some of these as well. So different ways to decrease inflammation, support the brain, protect, bring blood flow to the brain, support the immune system, and then thinking about adrenal support and to, do we need to identify another puzzle piece? Is there adrenal fatigue? Is there a thyroid issue? Do we need to refer out? Do we need to do some testing? And so then we come to mitochondrial support and lipid replacement. Very important to know about the cell danger response that can happen with Lyme and tick-borne disease. So sometimes it's really important. It's toward the end of treatment. At some point, though, it's usually important for all of my chronically ill patients to do replacement therapy for giving the mitochondria what it needs to create ATP. So with fatigue and cognitive issues, I'll usually be doing this at some point, and they'll see some positive effects. Connective tissue support. So Borrelia breaks down collagen. It's what it eats. So bringing back some collagen, literally, or these different ways that we can support connective tissue would be helpful. Nutrition. I often first will emphasize no sugar, yeast, or alcohol because this is the food for the pathogen. And then there are certainly ways, as you know, to do more with diet over time and meet the patient where they're at. Come in with pretty strict diets, have already done a lot in that way, or maybe they'll come in and they'll be really struggling just to so, there's quite a range of what we can do, and anywhere we can get closer to at least the basic diet is going to be really important. And so lastly, supporting the whole person. Naturopathic medicine, we're always thinking treating the patient, partnering with the patient on determining what they need and what's going on, opposed to treating Lyme disease. So what else might be going on? It might be really important to talk about stress and what kind of social support they have when they're navigating chronic illness. Also thinking about other conditions that might be going on or unidentified other, puzzle pieces, metal toxicity, or are they living in a house with mold, mast cell activation syndrome, all these other conditions, or finding other team members to address them with them is really important. Exercise. So during a Herxheimer reaction, the patient may not be able to maintain the same level of exercise, which for my more active patients is really, really hard for them. But it's really not recommended to do so when they're acutely ill or severely ill. When there's that worsening of symptoms, it's important to cut back on exercise. But that's more the cardio that they need to cut back on. They could do light weights and just not overdoing it. So it depends, again, on the patient, where they're coming from, their personality. But these are some recommendations to improve. Encouraging something like physical therapy is sometimes really important in certain situations. Depending on how deconditioned they've become, it might be important to get some extra help on reconditioning. There's a list of other time, so I'm going to be finishing up here. But over time, I've learned so much through working with my patients and collaborating with other practitioners to see that there's a place for so many of these other modalities, and really meeting the needs of the patient, individualizing treatment is so important. And talking to the patient to empower them to find the healing power within themselves. Chronic illness can be just demoralizing. So many patients have told me horror stories of how their doctor, how they've been told that it is all in their head, how their family doesn't understand. Just the struggle, the incredible a patient to navigate this illness can be just tremendous. And so really addressing that, again, everybody's in a different place. Some people have, amazing support and a spiritual practice and, do counseling or whatever else it is. It's more of a physical illness that they're struggling with, and that might be the worst of it. But if there are other pieces, then introducing people to that can help them navigate is really important. I see that so much. So, it could be, again, a list of different things that really resonate with versus somebody else, and just kind of finding that in with the person to help them not feel alone, to help see that there's hope, to help them navigate those tough emotional, spiritual struggles that they can be going through. Can't say that enough. Okay, so we're coming, I think this is the last slide. We've made it. So the course of treatment, sum up the approach. We've gone through signs and symptoms, testing, and treatment. I do want to make sure that we remember to individualize the treatment. There are templates, there are guidelines that I've shared. At the end of the day, I think there are certain principles that I apply, but then I also really treatment. One of the principles that's important is to change the antimicrobial strategy every 1 to 4 months. So we might a pharmaceutical treatment plan for Lyme. And, if they are severely ill, we might need to take some time with that same plan and move on in maybe 4 months. But if they are acutely ill, if they had a tick bite and erythema migrans, we'll move on after a month. An antimicrobial natural protocol and be finished in 2 to 3 months, most likely. So it all depends. I do see that pharmaceutical antibiotics are most effective early in treatment. So if you're going to do it, to have that conversation, do it. Sometimes patients come to me from seeing other practitioners. They've already done, 1 course, 3 courses, 5 courses. We might just move on to natural therapies at that point. Or the reverse. Someone may have only done natural therapies and never done any pharmaceuticals. It might be something to think about, to incorporate that. So again, identifying and treating the cause, identifying these puzzle pieces is so important. Creating a team approach with other practitioners to help patients navigate through. Yeah, so I think, we've talked about this, most of what's on this, and the tracking of symptoms, how important that is. Generally I'll follow up with patients every 1 to 4 weeks in the beginning, and then it'll spread out maybe every 1 to 2 months, depending on the patient's needs, depending on how complex the situation is or the protocol is. Like with Dapsone, we'll be following up sooner. But yeah, and it. So thank you for your attention. I know that was a lot of information. I hope it's helpful. Please let me know if you have any questions.
Dr. Chesney, thank you so much. That was really very comprehensive and so much information. I know I, for one, am really grateful we're recording this because you did a beautiful job of presenting all the information, everything pertinent with the different tests and the things to look out for and the complications of the co-infections. I can comment that in the clinic I work at, we've been using Dr. Horowitz's questionnaire at the end of our patient intake, and it is such a valuable tool. And I do see a comment and a question here from Kirsten, from Dr. Carl, and I completely agree. She says, thanks for such a great presentation. So good to see the expanding herbal options for TBD treatment. She mentioned some patients have not tolerated herbal tinctures at high doses long term due to the gastric irritation. So do you use any encapsulated forms? And if so, do you see a difference in efficacy?
Great question. Yeah, I know some people just can't tolerate the alcohol or just the longer term nature of therapy, or they might have an allergy, or they might have mast cell activation syndrome. So there are just so many issues that can come up. So I try and match where they are. Absolutely. There's Green Dragon Botanicals that has LB Core. You can also find like capsules of cat's claw, knotweed, and andrographis. Sometimes I'll piece that together with my Lyme Formula 1. With kids that can be more sensitive to tinctures, or thinking about traditionally made tinctures, the volume that you need to take with herbal tinctures. A company like Nutrimetics you can, like, it'll be 30 drops of Cemento, which is cat's claw, versus, you know, a few dropperfuls or something like that. So they're a lot milder, the Cemento and Banderol, et cetera, with Nutramedix. You know, there are other companies that have glycerates, like Beyond Balance. So I've used those with people. There's also homeopathics. You know, I didn't get all this on there because now we're in questions, so I'm going to talk about companies and all the info you want. Yeah, it's hard to write these things without mentioning the brand names.
Of course.
So Desbio is a homeopathic. I don't know if you know about them. That's also helpful for you know, people who might be sensitive. And then I'm actually working with an herbalist right now. We're going to do some suppositories. So it's going to be interesting because they do have just that batch of patients. You know, they've tried the glycerates. They've tried, you know, it's like you go through and it's just so hard for certain people, depending on what's going on. So I hear you. I don't know, hopefully that was helpful.
Well, yeah, again, you did such a wonderful job. I really appreciate all the detail with the naturopathic treatment. And that was so nice to hear. And what you mentioned, that we do have so many tools, because I know, you know, some people feel, as you mentioned, very anxious and even panicked if they feel they didn't get the diagnosis at the proper time. They didn't start the pharmaceutical treatment at the right time, can be so overwhelming. So that was just really impressive and comprehensive. Speaking of Nutramedix, I know we do have Kyle here, and if he wants to jump on and say anything to the group, we would love to have you if you're able to unmute yourself. I see we have some information in the chat, so that's great for Nutramedix.
Yeah, I don't know if Kyle just speak up if you're here, but I can say, you know, the research that I was sharing with Uncaria and
okay. He's saying he doesn't think his mic is working. Nicole, are you able to unmute Kyle?
I can't find his icon. I see him in the chat, but I don't see him on the screen. So let me continue to work here.
Okay. Yes.
As you're doing that, the Otoba is Banderol, and their cat's claw is Cemento. So Cemento, Banderol, and Stevia I use a lot as a protocol, like those three together as one of my rotations. Like I'll rotate for 1 to 3, maybe 4, not often, but months on one protocol and then go to another and see if there's a herx and kind of follow that. You know, and then we might need to add in a co-infection treatment, you know, and kind of build layering whatever we're dealing with. So that's another good protocol. And then the Cowden protocol I use a lot, and that's a Nutramedix product. It's a monthly kit that patients get. And sometimes, again, we have to think about the patient, but and what they're able to do, because it's complicated. It's 4 times a day. Some people love it. My really organized type A people, they just love it because there's a schedule and it tells you what to do when, and it's just very organized and they love it. But it can be overwhelming, you know, if people, you know, sometimes people feel like it's another job to do the Cowden, and it can be complex. So maybe later in treatment, I would do it when their brain fog, you know, clears up a little bit or something like that. But it's so effective. I've used it for, I guess, probably 11 plus years now. So that has the Cemento, Banderol, and Stevia in it with the serrapeptase for biofilm. And then it has panilla and berber and parsley. So it has a lot of detox. So, you know, I'm often doing all this with patients anyway, right? Because we want to hit all these pieces depending on the situation. So in a way, it's really nice that it's just all together, you know?
Yeah.
So it's a great option.
That's excellent. Yeah. So for those of us who are here with us right now still, and for those who will be listening to this on the replay who aren't joining us live, we want to thank Dr. Chesney. This has been a completely brilliant presentation on Lyme, and also nutrimedics.com. Go check that out. These are the formulas that we're talking about, and we are very grateful to our sponsor tonight, Nutrimedics. And the email for Kyle, who is here in the audience, is kyle@nutrimedics.com. That's Nutrimedics spelled NUTRAMEDIX.com. You can email him if you have any questions. And if you scroll up in the chat, nutrimedics.com, you can find out more about all of these formulas. So if anyone has any more questions, do please type them in. If you have questions about the formulas or questions about the presentation tonight. Again, this has been recorded, so if you're still digesting the information, you will have many chances to listen to it again.